What disciplinary action is in place if a health professional is found to not be adequately reporting adverse events or, as claimed firsthand, to be disregarding patient assertions? And that was originally sent on December 23rd. At the time, Brittany Candence had an automatic reply set up that she was away out of the office until December 29th. But how could this be, I wondered? How can public health take time off in the middle of, I think we're in the fourth wave of COVID-19 with the most virulent strain ever? I mean, this is a global pandemic.
Warning, censorship. Warning, censorship.
Well, hello, comrades. Tamara Ugolini here again with Rebel News, bringing you more public health silence and question avoidance. For an institution that has become a ruler of Canadian societal fabric under the guise of all things health and safety, they sure are silent when asked for justification and clarification. See, back in December 2021, I interviewed two nurses from the same hospital, one of whom wished to remain anonymous, and they made absolutely insane claims. By insane, I mean unbelievable. But these days, actually, I don't pause in disbelief anymore because the state of our healthcare system, of our government, I mean the state of Canada as a whole, is in complete disarray as we disregard every previously held pandemic response plan and replace it with hysteria and incessant propaganda, while using a small minority group as the scapegoats for the short failings and fallings of non-evidence-based and imbalanced approaches. In that interview, these nurses claim that hospitals were empty throughout 2020 as they braced for the surge that never came. Surgeries were canceled and beds were cleared to make way for COVID-19 patients who never showed up. And it wasn't until the COVID injectables began rolling out in December 2020 that the hospitals really started to fill up, but that patients suffering from direct adverse reactions were being gaslit into mental health referrals, medicated instead for anxiety and depression, not receiving treatment for their physical ailments, all while stacks of adverse events reports suspiciously went missing. These nurses didn't know if those stacks of paperwork were ever properly filed with the health authority. In this case, that would fall under the jurisdiction of Peterborough Public Health. So, in the nature of fair and honest reporting, I wanted to reach out to Peterborough Public Health. In fact, I ended up reaching out on a few separate occasions, and here is what I asked versus what I received in response. Small spoiler alert, it was a whole lot of nothing, which I'm no stranger to because one of my first viral Rebel reports actually included Peterborough Public Health.
So the fact of the matter is you've been asked to leave, you have to leave. You have to wear masks in here. By not wearing masks, you're breaching the current legislation in regards to the Emergency Act, and you can be charged $750 tickets.
At the time, I was researching why only one aspect of the mask mandate was being heavily enforced with complete disregard to the fact that exemptions were built into that legislation, the Reopening Ontario Act. And at the time, I had been redirected to Brittany Candence, the communications manager at Peterborough Public Health, who then further deflected me to the Ministry of Health, where I received a weird word salad response instead of direct answer, as is the nature of the bureaucracy, I suppose.
Any of the regulations under the Reopening Ontario Act that the province has put in place can be enforced by, municipal bylaw officers, by the city or county or OPP police, as well as public health inspectors. So anybody who's got like a provincial enforcement mandate can uphold this provincial legislation.
And that video went viral, so I'm sure that Brittany Candence is no stranger to who I am. But this time, she doesn't even attempt a response or a deflection. In my email pointed to her and the COVID-19 email address associated with the Peterborough Public Health Unit, I wanted to know some specifics around how adverse events are being reported. Here in Canada, we have an equivalent to VAERS, that's the CDC and the FDA's Vaccine Adverse Events Reporting System. We have a system called CAFIS, which stands for the Canadian Adverse Events Following Immunization Surveillance System. I have done other reports with now slandered ER Dr. Patrick Phillips, who spoke to me about how his reports were being denied by his local medical officer of health, and how the multi-layering filtration system of reporting makes it difficult for adverse reactions to be adequately recognized, especially when doctors are allegedly being bullied out of filing their reports completely. That said, point number 7 under header data sets, it specifies that CAFIS receives reports from regional public health authorities, and in this case, that is Peterborough Public Health. And Peterborough Public Health would receive those reports directly from doctors or institutions that they are working within, in this instance, a hospital, the hospital that those nurses were previously employed by. Which makes my questions super straightforward and, in my opinion, extra easy to respond to. See, I had asked, are nurses and physicians educated on how to identify adverse events? If so, how and by whom? Is there criteria in place that requires adequate adverse events profiling by staff in the emergency department? Does the health unit investigate allegations of underreporting or lost adverse events reports? If not, who is responsible for that task? Are there incentives in place for staff who claim they are already overworked and short-staffed to complete adverse events reports? Are they given paid and or additional time during their shift to complete these lengthy forms? And lastly, what disciplinary action is in place if a health professional is found to not be adequately reporting adverse events or, as claimed firsthand, to be disregarding patient assertions? And that was originally sent on December 23rd. At the time, Brittany Candence had an automatic reply set up that she was away out of the office until December 29th. But how could this be, I wondered? How can public health take time off in the middle of, I think we're in the 4th wave of COVID-19 with the most virulent strain ever? I mean, this is a global pandemic. But it was Christmas, so, having compassion and all that jazz, I let it slide. When I didn't hear back thereafter, I emailed Brittany once again in the same contact, that COVID-19 email address, on January 4th of this year, 2022. And look, another form letter. Brittany Candence was once again out of the office until January 5th. And I did receive some sort of weird, unrelated form letter from that COVID-19 email address about symptoms and testing and how to book vaccines, regulations for businesses and individuals. Oh, and how could we forget the complaint line, which is basically where people can snitch on their neighbors or anyone who they feel might be out living their life, not crippled with hypochondria. I wonder how quickly they respond to those requests and contacts. For Rebel News, I'm Tamara Ugolini. Rebels go the extra mile to get to the bottom of stories. We file freedom of information requests, we talk to paralegals and lawyers to help navigate the legalities around certain stories, and we research above all else. To support this kind of investigative journalism, please consider donating at rebelinvestigates.com. As you know, we don't receive funds from the government to keep afloat. We rely on the generosity of our donors. And so if you appreciate this kind of work and want to see it continue, please chip in if you can at that website again, rebelinvestigates.com.